Hello, everyone. Good morning, good afternoon, good evening, depending on where you're joining from today. My name is Paulina Sisius. I'm the managing director of the International Association for Feminist Economics. I'm standing in for Ashima Sina, who is co-chair of the Online Events Planning Committee and spearheaded this exciting event. She was unfortunately not able to join us today, but on behalf of the Online Events Committee, it's my pleasure to welcome you all to the event, Care Policy, Tools, and Initiatives of Feminist Economics Lens. Before we get started, I wanted to provide some friendly reminders for you all. Today's event will run for 90 minutes and will be recorded and posted on IAFI's YouTube page afterwards, where you can find all of our past online events. Additionally, this is a Zoom meeting and not a webinar. So this is a friendly reminder to please keep yourself muted at all times. After a brief introduction of the event and the panelists, we will have the panelists speak for about 50 minutes, followed by a Q&A later in the session. So feel free to put your questions in the chat throughout the event, and then use the raise hand function when we get to the Q&A portion. And our committee member, Fernanda, will help moderate your questions. The event is also being interpreted in Spanish, and you can pick if you prefer to listen in Spanish, at the globe function at the bottom of your Zoom screen. If you're having any trouble, one of the IAFI staff members will help you access the interpretation. El evento va a estar interpretado en español también, entonces si prefieren escuchar el evento en español, pueden apretar el globo a la parte abajo de sus pantallas. Y si tienen algún problema, alguien de IAFI les ayudará. I was translating in Spanish really quick to get folks to the interpretation. And lastly, we'd love for you to introduce yourself in the chat. Alrighty, so today's event is the second in a two-part series on the care economy, featuring discussion on care policy tools as part of the Online Event Committee's Research Methods event track. This track aims to cultivate dialogue on aspects of data, methodology, and methods that are useful for conducting rigorous feminist economics research and in turn inform policies. Now for a bit of framing for today's event. Feminist economists have long emphasized the central role of the care economy in advancing gender equality, as well as sustainable and inclusive development. As momentum on the care economy has increased globally, continuing to ground research and policy engagement within feminist economic theory and methods is imperative. The goal today is to bring together experts who can offer insights into the space of practical care policy tools and initiatives. Today, we will hear from pioneers and experts in the field who take stock of where things stand, identify key challenges, and reflect on opportunities to continue translating feminist economic research into actionable policy tools. We have with us today Valeria Esquivel, feminist economist from Argentina, working in the International Labor Organization as the chair for today's discussion. Valeria will set the foundation for this event and give us a background on care policy tools, followed by which we will have our four panelists covering two specific care tools. It is my honor to briefly introduce the panelists for today's events. You'll be able to find their bios in the chat as they each speak. For the first tool, the ILO UN Women Joint Program, promoting decent employment for women through inclusive growth policies and investments in the care economy. We have İpek İlkarakan, professor of economics at Istanbul Technical University, and our dear past president at IAFI. We also have Amber Parks, who is the Global Care Economy Policy Specialist at UN Women. For the second tool, the ILO Care Policy Investment Simulator, we have Jérôme Dohaneau, a senior lecturer in economics at the Open University in the UK. And we have Laura Adati, a maternity protection and work family specialist at the ILO. Without further ado, I will now pass it on to Valeria.
Thank you, Paulina, and thank you all. Welcome to this webinar, Care Policy Tools and Initiatives, a Feminist Economics Lens. And as Paulina said, this is an IAFI online event that is conceived as a continuation, if you want, of the previous online event, Advancing the Landscape of Research, Methodology and Data on the Care Economy. That was the name. So this time, the idea is to go from research, methods, and data to actual care policy implementation. And I wanted to start by defining care policies in plural. They are, broadly speaking, all public policies that assign resources to support caregiving. So care policies entail subsidies to persons who need to purchase care services for themselves, for example, to carry out activities of daily living, care services that cater to care recipients like early childhood education and care and long-term care of elderly persons, and time off from paid work to care in the form of maternity, paternity, or parental leave, and the regulation of caregivers' paid working times. So ultimately, the care policies determine who provides care, who receives care, and who is bearing the costs of care provision. And we know that without care policies, care responsibilities fall on families and on women in them. And with badly designed care policies, also on the shoulders of typically overworked, overstretched, and low-paid care workers. So with this broad definition, care policies encompass health, education, social protection, and labor market policies, as well as care-related infrastructure like water and sanitation. And they serve multiple goals, including poverty reduction, enhanced labor force participation, employment creation, and expansion of future generations' human capabilities. So this definition of care policies builds on the Sustainable Development Goal 5, which is achieve gender equality and empower all women and girls, and in particular, target 5.4, which calls for countries to recognize and value unpaid care and domestic work through the provision of care services, infrastructure, and social protection policies. In other words, by means of care policies. There are several aspects or dimensions to care policy implementation. We are not going to exhaust them all today. And these range from normative frameworks and the political agendas that support them to issues of design, costing, and financing in the sense of generating the resources necessary for the implementation of these policies. I wanted only to emphasize two dimensions that are important with regards to today's webinar. First, the normative framework. Following Target 5.4, care policies aim at recognizing, reducing, and redistributing unpaid care and domestic work, the so-called Triple R framework, initially proposed by Diane Elson in 2008. This framework was expanded by the ILO to the 5R framework in 2018, adding two Rs that refers to care workers, rewarding care workers properly, improving their numbers and the working conditions, and representing them in social dialogue and collective bargaining. This normative framework orients the ILO work and the United Nations work on care policies and has been endorsed by ILO, what we call tripartite constituents, meaning governments, employees, and workers, and by the UN system. The second dimension, and that is where the policy tools that are going to be presented today enter the picture, is making the economic case for investments in care services and care policies. So, how much does the implementation of these care policies cost once they have been designed? What are the social and economic returns of their implementation, and how can they be financed? Feminist economists have argued for long that care policies are not a cost, but an investment, one that builds current and future generations of workers and taxpayers, support well-being, and enhance human capabilities. So this webinar today will tell us how this case has been made. So this was my intro to the speakers today. So let me pass the floor first to İpek İlkarakan from Istanbul University. İpek, the floor is yours. Thank you.
From Istanbul Technical University. There's also Istanbul University, but I'm at the technical. Okay, hi everyone. Thank you, Valeria, for this framing of the discussions to come on the policy tools. And I hope everybody can see the slides in presentation mode. Okay.
Perfect.
So Amber and I will be presenting, as Pauline also mentioned, the UN Women and ILO joint policy tool on public investments in care services sectors. So let me start off by giving a brief sort of background on the tool, which will help us to sort of contextualize it sort of in the sequence of emerging thinking and research in feminist economics around this issue of investing in care. So public investments in expansion and upgrading of care services sectors has been a key component of the 5R framework. And the policy advocacy has been primarily from a perspective of gender equality, but also from the care recipient perspective of access to quality care services. So this is a proposal, obviously, that requires substantial public funds, so it's a matter of fiscal decision. And the experience on the ground, including my own, in my context, in the Turkish context, was that it often, such advocacy often met opposition from policymakers, from fiscal decision makers on the basis of competing demands on public budgets and limited fiscal space. In addition, also sometimes implied in the background was lurking the sort of, in a context of high unemployment and limited labor demand, the inability to absorb, even if these care services were supplied and women had access to this, and therefore, the time constraints relieved and they were entered the labor market, where would be the new jobs to employ them into? How would this new labor supply would be absorbed already in a context of high unemployment and high joblessness? So the background studies for these tools actually come from a motivation to explore a fiscal rationale and build the bridges of communication with fiscal decision makers for advocacy in public investments in care services sectors, emphasizing macroeconomic returns to such investments beyond the supply side returns that are very much related to gender equality, and also beyond the care recipients' perspectives. So that led to a series of that context sort of gave the rise to a series of empirical policy simulation studies on what I call demand side returns to investing in care services sectors. So here is a visualization that we use in the policy tool, looking at the sort of the supply side and the demand side mechanisms of investing in care services. So the right-hand side, the supply side effects, is the sort of like where the advocacy first emerged from, like decreasing women's time constraints, decreasing their time poverty, and therefore helping them to increase their labor supply on relatively equal terms with men, leading to narrowing of gender gaps in labor force participation. There are also a series of other sort of studies that were looking at mechanisms through particularly through improving access to quality childcare services and preschool education services, enhancing capabilities, enhancing health, leading to increased productivity and decreasing socioeconomic inequalities from the care recipient's perspective. What the tool does, and what it is inspired by, is a series of studies instead looking at the demand side effects, where given that the care services sectors are very labor intensive service sectors with high and some of the highest employment multipliers, that investment and increased public spending in care services expansion also has the potential for substantial employment creation, decreasing unemployment, improving labor force participation and labor earnings, and triggering poverty alleviation as well as demand-led growth side effects. And also, given the gender composition of employment in the care services sectors, favoring an increase in demand, in labor demand, particularly for women, and therefore helping to decrease gender inequalities, not only the positive supply side effects, but also the positive demand side effects on women's employment. So here you see it's sort of a set of studies. It all starts with two studies on South Africa and the United States by the Levy Economics Institute, and there are all authors associated with all of these studies. So they were all done by academics, people in research and academia, but very much in a framework also supported by policy think tanks and UN agencies and or trade unions. So the reason the Turkish and the ILO studies, the 45 high and middle income country ILO studies are marked, and Valeria was and Laura were also involved in the 45 incomes country study for the ILO Care Work and Care Jobs reports, was because, first of all, the Turkish study was first to go beyond simply estimating hypothetical returns, but also first to use national data to undertake an assessment of care services coverage gaps and undertake a costing exercise, and then feed that into the simulation, like being well-founded in national data. And the ILO study did the same thing, followed in the footsteps of this study, but also it included, was the first to include 4 different care services sectors, not only early childhood care and preschool education, as most of the studies were focusing, and long-term care, but also healthcare and education, including primary, secondary, and tertiary education services. So these were the basis upon which the UN Women and ILO Care Investment Policy Tool built on. And then we will hear from Jerome and Laura also on the ILO Care Policy Simulator shortly. Let me see if I can move. Okay, so the tool basically provides a methodology that can be implemented by national research teams to identify services coverage and quality gaps in care services, to estimate the costs of public spending, to eliminate these coverage gaps, and assess various economic and social returns in the short and the long run. So I will explain a little bit what each step entails, but the steps 1 and 2 basically provide a basis, a guidance for data analysis on which national policy practitioners would be able to develop an evidence-based policy roadmap for expansion of care services. And the third one, assessing of returns, is basically aiming at providing a basis for advocacy, evidence-based advocacy, and making the macroeconomic employment generation-related case for investing in care services sectors. So the assessment of coverage gaps basically entails a whole range of decisions that the people implementing the tool need to make within a given national or local context, which care services sectors to target, and we have these choices. And beyond these four sectors, what we have been observing by different national country teams is, even taking more targeted groups such as care and sports services for children of school age with learning challenges, for example, or care and sports services, social services for women and children survivors of domestic violence. And then the assessment requires making a number of decisions about appropriate policy targets in expansion, quantitative targets, service coverage rates, and qualitative targets. And this results in basically in estimating how many more potential care receivers or providers are needed to achieve the policy targets. The second step on the costing, again, entails making a number of decisions within a given context, determining the prevailing, first of all, the prevailing unit and operational costs of public provisioning of these services, but then adjusting that unit cost in order to improve employment quality as well as service quality, and assessing the total cost. And the tool also provides some guidance as to how to sort of contextualize this within the overall national macroeconomic context, comparing it to prevailing public expenditure patterns, and evaluating it in a context of, for instance, a need for jobs generation, the context of labor market unemployment rate and labor force participation rate. The final step, estimating the demand side returns, where the results from step 1 and 2 feed into this step, is basically looking at direct employment generation outcomes, jobs in the care services sector on which public spending is being allocated to, as well as indirect jobs, the effect on creating jobs in other sectors through backward and also possibly, if the teams choose, also forward linkages, and the gender distribution of these jobs. Another return estimation has to do with tax revenues generation, the increase in tax revenues through increased employment and earnings through direct and indirect taxation, and the self-financing potential. And if there is the intent and the capacity to do so, undertaking a microsimulation modeling to further look at distribution of jobs by a variety of demographic characteristics, earnings generation and its distribution, impact on household income, poverty reduction, and on gender employment and earnings gap. And also through macro modeling, another possibility, and I think you heard about this a little bit more last time from Özlem and her colleagues' work, is the macroeconomic impact other than jobs on economic growth, productivity, and a series of macro variables. I will end by saying, and pass on to Amber by saying, that the scope of this tool is we call it like investing in care policy tool. But when we say investing in care services sectors is not the only investment, although it's an important component. So this tool focuses only on number one. But when we say investing in the care economy, other key components are, for instance, in some contexts, investing in time-saving physical infrastructure and technologies to reduce indirect unpaid work, also investing in labor market policies, regulations, and practices for work-life balance, such as care leave policies, care insurance schemes, and so on. So this tool focuses on number one. And I think when Jerome and Laura present, for instance, the ILO care policy tool also does have a component, for instance, on investing in care leave. On to Amber.
Thank you, Amber.
Perfect. Thank you so much, Ipek. Good morning, good afternoon, good evening, everyone. Such a pleasure to be here with you all for this conversation. And huge thanks to IAPI for bringing us together today. I want to start actually by thanking you, Ipek, for developing this tool together with UN Women and the ILO, and for collating and synthesizing these findings that I'm now going to present. So I'm going to run us through some of the findings, impacts, and insights from applying this tool together with the ILO in 5 countries between 2022 and 2024. And as Paulina mentioned, this was through a joint program that we had together, but has really evolved to be used in many other contexts as well. So just to situate us a little bit here, the 5 countries that we applied it in and that we're talking about today are Argentina, Ethiopia, Egypt, Morocco, and Nepal, very diverse economies and contexts. In Argentina, they applied it at a subnational or provincial level. And you can see here that they all focused on early childhood care and education. In some countries, they also focused on some other care sectors as well. Obviously, all the countries looked at jobs creation potential. And then in Egypt and Nepal, Ethiopia and Nepal also looked at GDP growth potential, and Egypt and Morocco looked at fiscal returns potential. Next slide. Thanks, Ipek. Moving to some of the findings from applying this tool. There were really, I think, 4 buckets of key findings that were very compelling across the 5 countries. The first, perhaps not surprisingly, is that there were substantial care coverage gaps under the maximum or high road scenario of universal access, with the cost for covering these gaps ranging from 2.8% of GDP in Ethiopia to around 4.5% of GDP in Egypt. But the second point, that closing these coverage gaps has the potential to enable both quality care outcomes, really importantly, and also generate decent jobs to a major magnitude. So, for example, in Ethiopia, where they focused on early childhood education, the projection showed an estimated 6 million new jobs potentially created, with the potential to increase total employment by approximately 15%, with almost 2/3 of those jobs going to women potentially. Third, that substantial jobs generation means obviously also substantial earnings generation and self-financing potential. So here in Egypt, for example, when we ran this analysis, as I mentioned, around 4.5% of GDP needed to close those significant care coverage gaps, but that up to potentially up to 41% of these total costs could be covered through the generation of new tax revenues, potentially. Fourth, finding that, as we know, as this employment demand emerging from care investments favors women's labor, there is a potential to narrow gender gaps in employment and earnings. So, for example, here this was illustrated in Ethiopia, where the simulation showed the potential to reduce the gender employment gap by almost 6 percentage points, with a potential GDP per capita growth effect of approximately 4%. So taken together, these findings across those 5 countries really highlighted the strong multiplier effects that Ipek was just speaking about, supporting the hypothesis, as we heard, that's long been held by feminist and heterodox economists, that such investments produce tangible economic and social returns, hereby providing an important economic rationale for increased resource allocation in these sectors. Next slide. Thanks, Ipek. Okay, so now I want to touch a little bit on after the results were generated, the findings published, disseminated, what came next in terms of policy impact. And I think this is what we were really wanting to also focus on today, as Valeria was saying. So we found the use and application of this tool in the way that it has been designed and the time it takes to do has been a really strategic entry point, a starting point, if you like, for building political will, for enabling policy dialogue, and then supporting policy action. So here are a couple of examples to pull out. In Nepal, for example, after the study was conducted, the lead agency, the National Planning Commission for Nepal, established a national care working group that brought together different ministries to take forward this agenda in Nepal. The findings were also used to contribute to the 16th five-year National Development Plan. It led to another piece of work around looking at different care delivery models for different segments of the population. And really importantly, was one of the catalysts, obviously not the only, but one of the catalysts towards the government beginning to draft its first national care strategy. This was obviously all before the changes to the government late last year. In Morocco, again, some really exciting policy impacts here. The findings were used by the government to contribute to the Moroccan new development model. They were used as part of the 2022 National Gender Report. They were annexed as part of the draft budget law presented to Parliament. The government now is leading its own assessment with some support from UN agencies on assessing long-term care services, following up from their assessment of early childhood care education. And this is being led by their Department of Financial Studies and Forecasting. And again, really excitingly, the government is drafting its first national care policy, the first for the Arab States region, which is fantastic. And I also wanted to share some insights from applying the tool, and here also thanks to IPEG for really helping to synthesize and bring these together, and of course to all the country teams and ministries that led this work. The first and second points here, I think, are probably pretty obvious to most of us, that having the government buy-in and being able to link this to existing motivations and policy priorities was really key. It was both an outcome of applying the tool, but also a precondition for the longer term policy impacts, the types that I was just presenting earlier. And when we say government ownership, what we mean here is having a lead agency that took forward this work that had either a fiscal mandate or a mandate to coordinate other departments through a whole of government approach. So, for example, I mentioned in Nepal, the National Planning Commission that led the work there, they had a mandate on coordination across different ministries. Whereas in Morocco, it was led by the Department of Financial Studies and Forecasting that has a fiscal mandate. So two really strong examples there. And aligning with the national policy targets, again, they're not surprisingly where the capacities of the tool were able to be linked with existing stated policy objectives, whether that was around narrowing of gender gaps in employment or increasing care outcomes for specific groups such as children or older persons. There was obviously much stronger motivation and buy-in for implementing the tool. The third point here around political feasibility really relates to one of the features of the tool, which is that it generates both the, as Ipek mentioned, the ideal or high road scenario for care services expansion, which obviously entails substantial allocation of resource usually, but it also can generate a progressive expansion scenario based on lower cost, shorter run scenarios. And so here, this what we sort of call a roadmap approach was more politically feasible, as it allowed governments to see the roadmap, if you like, from expanding and upgrading care services over a medium-term plan towards that ultimate goal of universal access. plus high service and employment standards. The fourth point there around ECCE services or early childhood services was really just to emphasize that, as you saw, all the countries focused on early childhood education. And it was really a common starting point. We know early childhood care and education is critical, but it's not the only important care service within the care economy and a care system. However, there is often strong politically neutral interest in investing in care services for young children. And most countries do already have a national childcare strategy and existing policy targets. So we found this to be a really good entry point, if you like, for beginning this, for beginning the conversation and for applying the tool and seeing its potential. And as I mentioned, now in Morocco, having seen that potential, they want to apply it to long-term care services. Number 5, the potential for expansion or extension to under-resourced subsectors, as Ipek mentioned. I think that's some really exciting potential there. In addition to applying it at a subnational level, as they did in Argentina, but particularly interesting to think about cases where care provisioning is a mandate of local governments and where we can get sort of sometimes more and better data as well. So some real potential additional applications there. And finally, just a recommendation really to include not only the analysis of costs and jobs creation, but also the assessment of tax revenue returns and fiscal contextualization to further make the case and economic rationale. We found that was really important. I'm going to close there because I know we're at time, so I'll hand back to you, Valeria. Thank you.
Thank you. Thank you very much. I want everyone to have their time, and at the same time, I'm concerned that we are eating up the time for questions and answers. So without further ado, I pass the floor to Jérôme Dehaene. And
thank you, Valeria. I really apologize for my voice is terrible, but I will try to hold on to that. I'm just going to share quickly my screen and go straight to. Can you see it? Yeah. Whoops. And so it's basically what. Oh, can you see the? Yeah. Basically, what the Ipek and Amber have already presented in terms of the the motivation and the rationale for the investment in the care economy. Oh my God, it's terrible. Sorry. And so we built this tool with the ILO, with Laura's team at the ILO, to really look at 4 policy areas, which are why is it not moving? Oh, here. Yeah. So to calculate the direct annual investment spending in 4 policy areas of the care economy, mostly closing the childcare policy gaps by having an increase in the parental leave, the paid parental leave for both mothers and fathers, and equalizing those pay as much as possible, as well as providing childcare services of high quality following the end of the paid parental leave all the way to primary school. So that's the idea of the childcare paid policy gap to be closed with universal access and good working conditions. We managed to simulate that for 118 countries, or across all regions and income groups, obviously a little bit geared towards higher and middle income, but we still had some low and lower middle income countries. And then also look at providing paid breastfeeding breaks for mothers and universal access to long-term care for all children, adults, and people over the age of 65. This is just me going really quickly on the actual methodology on which the rationale and the background are very much what Ipek has presented. So the policy user is able to choose different policy targets in order to achieve a high quality scenario on pay levels, on staffing requirements, on coverage of trying to achieve a good coverage of needs, for parental leave to have a high replacement, or for those in formal employment, a minimum payment available. And then we use the country available data on different parameters that will influence the results. And we project the data for 2030 to 2035, so that we have the time for it to be implemented, but also a reasonable understanding of different demographic change by then. The calculations are not very important, and they're very similar to what IPEC has presented. I mean, they are important, but in terms of understanding, basically, it's arithmetic in terms of costing. You look at all the elements you need, you cost each element, and you add them up at the country level. And then you look at the employment effects, which are using indeed the input-output multiplier effects that IPEC described about the direct employment demand, and then the indirect effect in the economy. And you can add, if you want, but you don't have to, the effects from economic activity and consumption, which is called the induced effect. But we also looked at the wage gaps and the effect on gender wage gap by looking at the creation of employment and increased earnings for women relative to men, and what it does to gender wage gap. And some tax revenue indeed, both on the demand side at the macro level, and also some lifetime earnings gain that can be then transformed for those countries with relatively developed tax system, income tax system, to recoup some of that investment. So that's basically what the results are in terms of the total employment creation by gender in different sectors, the effect on employment rates, the effect on gender wage gaps or monthly earnings, the tax revenue, so that we can calculate the net investment, and the economic return. So looking at if mothers are able to regain their earnings for continuing employment as they were before the birth of their first child, how much would that cover in terms of GDP effects or earnings effects relative to the investment? And a development could be on fiscal effects. So these are just quickly a series of examples. This is, for example, the annual long-term care investment in some selected countries or high-income economy, just to show that the scale of the investment needed. But obviously, that the spending required depends on the demographic of each country and some of the economic characteristics. So not everyone will reach the kind of benchmark Nordic models of investment, but all of them will have to spend a lot more than what they are currently spending. Another example was we looked at Ukraine in context with other Eastern Europe or Central Europe, after the government asked for a specific study about it, and that just gives you the sense of like the different elements for looking at the childcare policy gap on the investment, currently annual investment, and then doubling up to achieve the ambitious targets. And with the parental leave, which is quite developed already, not too much more to spend on, it would reduce the gender earnings gap in all countries. And this shows you the potential for achieving a return on investment in terms of the economic gains over the lifetime of lifetime earnings of mothers. This is the current gap. So 52% mothers of that age earn 52% overall compared to fathers. So considering their employment rate, their working time, and their average wages. But the policy would only need them to achieve a slight increase to have a positive return on investment. And also we expect those gaps to be much the closing of the gap to be much substantial, thanks to universal childcare. So that the return on investment, when you look at the economic return, so the effect on earnings would be $6.5 per dollar spent on childcare and parental leave policies in Ukraine, and the fiscal return would be almost 3 times the investment. So this is quite huge, and that obviously is all related to the huge employment gap between mothers and fathers, and then earnings gap. I'm gonna stop here. We have some technical details, all you need to know in the technical note, but I know we're out of time already, so I'll pass on to Laura. Thank you.
Thank you, Jerome. Laura, please.
Thank you, Valeria. Thank you, Jerome and colleagues. And thanks so much to IAFI for this opportunity to present our tools and our work. It's really exciting to see so many young feminist economists joining today, because what also we are sharing across these partnerships and this tool really builds on the work of generation of pioneers, and having the new generation looking and getting inspired is really important for what we want to achieve with these tools. So I'm presenting the implementation, what we've done at the ILO with try to do with this tool in partnership also with other organizations. As Valeria mentioned, our approach is really normative. We do this. Investing in Cares Matters is grounded in a number of frameworks: ILO Transformative Agenda for Gender Equality, a number of recent declarations, but recently the ILO resolution concerning decent work and the care economy. That is the first tripartite agreement on this topic, and I really invite everybody to have a reading. Really sets an important context, a common understanding, guiding principles, policy recommendation that really are grounded on this 5R framework, and also are accompanied by a plan of action, practical plan of action to guide ILO work on this, on 4 mutually reinforcing components, and under knowledge development, dissemination, and communication, but also strictly linked to technical assistance and capacity building. We have these tools, but also the policy tools that we have heard from the ILO UN Women Partnership. So these tools are really grounded on the work we are doing, translating commitments into action. So I'm gonna talk how we work and what we've done, keeping in mind that the simulator is part of a set of online tools, and this is really the difference between the 2 tools. This is really something that is already available online that you can use, that embeds all the indicator and the information. And then really the point is to translate these into direct technical assistance. So we have 4 tools because for making, to bring action, we want to make the first case is making the gaps visible, then building the investment case, assist through peer learning and technical assistance, implementation, and then guide getting the implementation registered and captured. So we have a really a circle of learning and sharing. So the first tool is the ILO Global Care Policy Portal, which hosts a number of data, legal indicators that gives you a picture of what are the policy gaps around a number of indicators, building essentially on ILO international labor standards that are international treaties on care policies. So this is the starting point. Users can select by country and show and learn what's the status of care-related entitlements in a country, legal coverage, and so to get to this care policy gap that we want to close through the simulator. So you see you've been increasing topics, indicators, and countries, bringing really the work since 1994 that the ILO has been doing on this. And so just a little overview, because we have to see the impact that these are online tools, how the, the visits, 27,000 unique users since the tool was launched in March 2023 to a recent assessment with more than 36,000 visits. So this is really show the appetite and how this is really relevant after its launch. Then we have the simulator that Jerome has described in depth. This is also been popular with 3,000 login for 1,700 registered users from 100 different countries. So this has been really also an important tool also for academics. So we have also the data on the users, and we see academia really placed very high with governments, but also ILO agencies and other users. So this shows that this has been a tool for knowledge development outside the also ILO let's say word. And then the third tool is the ILO library, where we have translated the results that you find in the online tool into global reports, but most importantly, regional briefs, for regional briefs and over 30 country briefs, where we have packaged basically the information available in the first two tools into a kind of ready-made quick assessment that we can present at the country level or kickstart the conversation, get national stakeholders, constituents involved, start the conversation, and possibly maybe going more in depth with, the policy tools, having more ad hoc and in-depth discussions. And then finally, the recent little sister of this set of tools is the South for Care platform, where we have basically answered the question, how can we show concretely practices that can demonstrate what can be done when there is this buy-in and countries want to take action and they want to learn what others are doing and how we can implement the resolution, and how we can bring together through South-South cooperation, peer learning, and knowledge exchange, the practices, what has been already done, not to reinvent the wheel. So we have this platform with now 30 practices for 25 countries growing. And also this has been also very popular with over almost 5,000 views. So in terms of implementation, these tools have helped, as Amber also showed, generated dialogue, reform, aligning to international labor standards. So we put together with my team some examples. The simulation were used for the European care strategy. Also recently, global results were mentioned in the UN resolution on the care economy for sustainable development, a number of roadmaps, social security reforms in Oman, Jordan, but also Indonesia, Uzbekistan, ratification of ILO conventions. These have also been possible having this information, this knowledge. Just a zoom about the amazing work that has been also carried out in collaboration with ICLAC in the region. Jerome has been involved, a number of ILO experts, supporting the design of national care systems in a number of countries, which I've listed. The work is still going on, but also having this powerful data and assessments in the study that you see on the right, being used to influence like the Inter-American Court of Human Rights, but also the Tlatelolco commitment. Please read this very powerful and inspiring outcome. Then the next step, bringing the knowledge to practice. So diluting, accompanying national constituents through capacity building that we have carried out a lot in partnership with International Training Center in Turin, at the global level, online, ad hoc services in Egypt, Turkey, Sri Lanka. And most recently, through the South for Care Learning Hub, this is linked to the platform, this new way of delivering through South-South cooperation. So bringing all this knowledge and these experiences together through an opportunity that took place in Qatar last September. So, and one is now planned in Sri Lanka. So here I've just pasted some of the quotes that we collected, because this is really the change, as also Amber showed, that we want to generate through, and this noise means that my time is off. So this is really the change that we want to generate from our partners. So in conclusion, this is really being essential for technical assistance, because we cannot have tools and knowledge if we don't accompany them with technical assistance. It's difficult sometimes to find direct causality between a study, some macro simulation that ended up in the study, and then what happens in terms of policy change, because policy change is super complex, and it depends on many aspects. But if we would want just to look at ILO technical assistance, the results that we have reported under our programmatic work, we see that there has been an amazing amount of results under different areas of the 5R framework in basically virtually all the world, in all the regions. 34 countries that reported results. I mean, we work in many more, but these are those that reported results, and it's an increase from the 20 countries that reported results in the prior biennium. I stop here, and thank you.
Thank you, Laura. Thank you, Jerome. Thank you, Ipek. Thank you, Amber. For those of you who will be in Cali, in IAFI, you are certainly going to meet some of the people that were there in the last slide, which is from Colombia, amongst them Natalia Moreno and Isabel Arena. So those are our hosts in IAFI this year. We had prepared a follow-up question, but I will omit it because we need time for the Q&A, and perhaps I come back to it afterwards. So I pass the floor to Fernanda for questions from the audience.
Thank you, Valeria, very much, and thank you for all the panelists. So now we're open the floor to the audience. Feel free to ask questions. You can put your questions in the chat or raise your hand, and we'll call on you to come off mute. Just in the interest of time, please keep your questions brief so we can have time for more questions. And then maybe let's take 2 or 3 questions in a row and then ask for our panelists to answer. Anyone wants to start? Well, I do have one small question from the chat before, while people are raising their hands. It is a question from Annette Abenakio. What policy engagement strategies did you use to cultivate the appetite to invest in care? And how long did it take to achieve impact? I think that's a great first question to start. And maybe if anyone has more 2 or 3 questions, we can bundle them up for the panelists.
Fernanda, do you want to jump in?
Sorry, Amber, I didn't hear you.
Sorry, Fernanda, did you want us to jump in, or are you taking a couple?
I thought we could start with this question. People are asking for links in the chat and tools, and I saw Ipek already responded to some, so I think we can answer this first question first about the policy engagement strategies did you use to cultivate the invest in care, and how long did it take to achieve impact? Maybe Amber, you can start because it sounds around implementation. Thank you.
Sure, I can jump off and hand it over to others as well. That's such a great question, Annette. And actually, for us at UN Women, and I'm sure for the ILO as well, the entry point to starting this engagement was through the costings tool. That was our entry point for starting that political engagement. For some countries, the engagement has started more around time use surveys, and that has been their entry point to this discussion on the care economy. We found this policy tool, though, enables us to go beyond just that data collection to asking those essential questions of what are the gaps, how much is it going to cost me, my ministry, my government, and then how can I convince my finance minister to allocate those resources. So for us, that's sort of been the number one engagement strategy. How long has it taken? Really different and diverse between different countries. In Morocco, it went quite quickly, but there was already a lot of work that was done beforehand. They'd done a time use survey some years back. Nepal, it took a little bit longer. So really varying country to country, depending where they're at in that sort of longer trajectory. I'll pause there and see if anyone else wants to jump in.
Maybe I'll complement from also the experience of the simulator. We built this tool because as ILO, as a normative organization, we come with our standards, and we promote the implementation of policy reforms around the care policies. But something that we kept hearing is that this is too expensive, it's unfeasible, especially in different contexts. So the idea was to bring this investment case to show that the investment was really worthwhile, that there was a win-win, and it really brought benefits. And this is really the buy-in that we want to bring to the table when we prepare this the study, something ready that can complement with evidence this tripartite discussion around maybe the ratification of a convention, a labor law reform. For instance, in Colombia, in the context of the labor law reform, we were asked, that included the extension of paternity leave, we were asked to prepare ad hoc macro simulations for the extension, the progressive extension of paternity leave. So the tool offered this flexibility to come with, of course, the bill, but also with the benefits that this would include. And then, of course, it's the context of the country, but the fact of being quick and respond to a hearing in Parliament. You need to assess something that is happened very quickly. We were able to do this with this tool. So this is something that adds to also the fantastic technical assistance that other tools provide.
Thank you, Laura. I think we have like a couple of questions in the chat, and I'll try to bring them together so we have like the other panelists contribute to this. I think the first one is interesting from Delaney. What policy would you recommend for the 3 Rs or 5 Rs in a context where most employment is in informal sector? And then a second one that I will kind of summarize a little bit. Andrea asked about what is possible to obtain. Is it possible to obtain disaggregated data on the investment already being made in care policies from the simulator? And then Kizan below it has a question regarding emerging risks, particularly in SIDS, that is small island states in the Caribbean or Pacific, with jobs created, revenue increases for government balance out with this risk associated with climate change. Maybe these are two questions we can ask around what's in the simulator. Yeah, I think we can go from there, and then I'll summarize the next ones because they're quite long. Please go ahead.
Jerome, perhaps about the disaggregation, you could go.
Yeah, sorry, I'm trying to find the question in the chat.
I thought you were going to say my voice, but okay.
No. Yeah. I'm not sure I understand the disaggregation of the investment, but definitely you can have the elements of the investment that are short. For example, the staff cost, the costs for the construction, for the other elements, and also by playing by playing with the user parameters on, you can change the salaries or you can change the coverage. You can see the impact it has on the costings, and from that you can then derive the how much that contributes to the total cost. There is also some data, but depending on the country, data about the current spending on different elements, so as to compare with your policy objectives. In terms of the climate change and the small island countries and Caribbean, I mean, we don't necessarily have that, but that's definitely, as Valeria will ask us in a minute about future developments and policy, that I will answer that at that point. But I can't remember the other question. Sorry, I'm trying.
On the
I'm lost in the chat.
informality.
Oh yeah. So that's also a very important point, especially in the low and middle income countries, that the assumption, as Laura said, that from a normative perspective, the idea would be to invest in formal jobs that will create employment in the economy, but that will produce a lot of formal employment from which currently informally employed people could switch to, or a different shuffle. But it's definitely with the aim of having full social protection, good wages, and some and kind of initiate a virtual circle of improving working conditions in the whole economy, not just in the care paid sector.
May I follow up on that? I'm not. Now Fernanda is in charge, not myself. But one crucial characteristic, and also emphasizing the relationship between our frameworks, our normative stand, and our simulation, is that in all cases we've our thinking is about investments in care services and in care policies generating decent work for care workers. That is the two R's that complement the initial three. Because it's I mean, not only because of the working conditions of these workers, most of whom, as Laura mentioned, are women, but also because it is clear that quality care is associated to good quality working conditions for care workers. Those are the two sides of the coin. So in all these simulations are not out of the blue. They are informed by the normative stand we have. And before these agreements, there were some policy interventions recommended that had stipends for care workers, that were not paying attention, that were so focused on care recipients that were not paying attention to the work conditions of care workers. So that is common to all our tools, and in fact, to all our technical support. I wanted to emphasize that. Thank you.
Can I add on to what Valeria just said, that, I mean, the focus was on care receivers, but also on relieving family caregivers, right? So with very little attention to what was happening in the conditions of the people taking over this work on a paid basis. So both tools, the way the tools operationalize this, and I think both Jerome and I have said this, but maybe good to reiterate, is that when we undertake the costing estimate of how much public spending is required to meet certain coverage and quality targets, is that we adjust the unit costs for decent work conditions for care workers, for formal employment, social security covered jobs, and decent wage levels. And depending on the country context, what that upgrading of the work conditions and the wage levels are may differ. But there's a lot of discussion, in the reports that came out, and also in the tool
Thank you very much, Ipek. I think that also touches upon a point that Shakuntala had brought about unpaid care. So thank you for already pre-answering that question. And I think I'll bring maybe a final one if we want to get to Valeria's and Paulina question at the end. But there's a question here talking about how the tool is primarily on public investment, rightly so. So the question is, did your findings have any observation on the private sector engagement in complementing the costing of care? I don't know if anyone would prefer to take that on. Please feel free to volunteer.
That's the $1 million question. It's again a normative approach. It's the idea of investing in the care economy is very much about making it accessible, affordable, and with decent working conditions. Hence the idea around the representation that Valeria mentioned. But it is agnostic in a way about the private or public delivery, but it is definitely a public investment. So that it requires collective funding. It requires an approach that will not be possible only from private funding. It doesn't mean that the delivery can't be made by private actors, but when you look at all the care services that exist in the world, they exist because there is public funding. So it can be delivered privately, but they are viable only in terms of reach sufficient people, especially those more unfair, deprived areas, etc. It requires public investment. So that's the idea underpinning both tools. I understand, because obviously care has characteristic of a public good and need public investment in order to be sustainable.
And just to jump on that as well, as Jerome was mentioning, that's a piece of work that I mentioned in Nepal that the team was doing now, looking at different delivery models and options based on the findings from the costing study. And there are many other countries that are doing this work as well, several others in the Southeast Asia region, Vietnam being another one, looking at this question of how that should be delivered by whom and where. Ipek, did you also want to come in?
Yeah, I just want to say that I guess there is a kind of sort of implicit assumption of all these in both tools in these exercises, that to the extent that ability to purchase is there, that private sector provisioning already realizes itself. And if there is demand, excess demand over supply, that's because the ability to pay is not there. But so there's that sort of implicit assumption. But in in trainings on the tool, in meetings on the tool, we always sort of leave the question of the modality of service provisioning and the different mixes of financing an open question, open to, dependent on the national context. So there is no imposition there that it has to be all publicly financed or provisioned.
Thank you. Yes. So because we are coming to close to the end, and because we wanted to leave some last question, and I will start by Ipek if you are able to before you leave. But according to you four, what is still missing in this care policy space, and what are the plans to address these gaps? So, Ipek, perhaps we start with you.
What is missing?
What is missing? I mean, because I think that the message is we've done so much. But perhaps there are some missing bits and further developments, either in policy or in tools, however you think about this. But I'm sorry, I'm putting you on the spot because I know you have to leave. But,
yeah. Okay. Well, I would say there's more work building on the emerging studies on the different sources of financing and their implications for building comprehensive care systems, and also a compilation, as sort of a living compilation, digital compilation of good examples. And I think when Laura talked about the, what is it called, for South?
South of Care platform.
South of Care platform. Yeah, so, bringing in information, but detailed information where national stakeholders, people involved, can contribute from different angles critically, and also just by providing information about national level initiatives, local initiatives, concrete examples. This is I mean, wherever I go, whenever I talk about these things, and then in the care economy trainings, gender and economics trainings, the main question is, what are some good examples?
Perfect, thank you. Now you are free to take the floor in whatever order. Thank you, Ipek, very much.
Maybe if I can jump in, because Ipek mentioned tax, sources of funding, and indeed I think that would be, in terms of development of the tool and as an advocacy tool, but also to understand more about it, to try and simulate the possibility or the dynamic way in which formal employment may increase tax revenue, the tax base, but obviously that will depend on the politics of the country and the increase. But I think this is the way that ultimately care will be self-funding through its own internal revenue, rather than international interventions, as it happened in other contexts. But it would be interesting to simulate that. The other aspect is about the green credentials of the care economy and the discussion around adaptation. And Ipek and I are involved with Karen Grown, who I actually think is on this call as well. I did into some research on understanding care as an adaptation to climate change, but also how to adapt care services to climate change in response to the questions around the island states and Caribbean, and modeling the kind of whether resistant and resilient care workforce, but also infrastructure, physical infrastructure and social infrastructure. So that would be both in terms of an adaptation strategy, but also showing the mitigation aspects of shifting the economy from an industrial to a more service-based but caring approach to economic activity, because it has much higher green credentials. And I'm working with UN Women at the moment to do some simulation of that in terms of the greenhouse gas emissions. Sorry, for the future Progress of the World report. And then within that, a kind of reflection on the kind of the sustainability of an economy that is post-growth. I know it's controversial, but it's looking at the care economy potential for a steady state, where all these elements are actually self-sustained without the needs for economic growth, once we have reached a minimum level of well-being and poverty reduction, etc. Obviously, that's important. So that would be my 3 avenues for future development.
Thank you, Jerome. Amber or Laura?
Yeah, thanks, Valeria. I can jump in and actually build on, Jerome, your point. I completely agree. Perhaps this isn't what is missing, because it is happening, but what else can complement, or what else we can further strengthen. And one aspect is this idea of care jobs as green jobs, as you were speaking to, Jerome. And that's something that we are wanting to support more countries to do that analysis, particularly where it is aligning with existing policy objectives and priorities. So looking at the analysis of carbon emissions through care service sector expansion versus other sectors such as construction. There's been great analysis done in the UK on that, very compelling, but across different economies, less so. And so it's fantastic, Jerome, that you're working on that. The other area of comparative analysis to further strengthen this fiscal rationale, again, this has been done through other simulations and countries, but building this into these policy tools going forward, is the analysis of returns to care services investment versus investment in other sectors, such as infrastructure, for example. And that's obviously physical infrastructure. That's not to say that investing in physical infrastructure isn't also critical, particularly in lower income countries, critical for women's time poverty, but to highlight the benefits of care services as a worthy fiscal allocation. And then finally, on the fiscal space question, this is the number one thing we come up against. IPEC, who's been in all of these trainings with us, we have people who are bought into the idea, have done the simulation, but the question is where to get the upfront costs from. So that's this next piece. And here I will just drop into a chat a policy framework on engendering fiscal space that we've worked on at UN Women together with many IAFI members, Valeria, IPEC, others, I'm sure, who are on this call, and Anurada Seth as well. So let me pop that into the chat here. Thanks.
Excellent. Amber. Laura, would you like to chip in?
Thank you. I would like to, instead of adding to our tool, maybe production list, I wanted to highlight maybe gaps in implementation, which I think maybe calls the world of academia and also the UN really to think how we can bring really the strong evidence that we have brought already so powerfully together to translate this into really coherent integrated systems and investment, really real investment. And I think we have to also admit that the context is challenging. We have to be realistic, but we don't have to give up. So we will continue showing what's working, how to do it, pushing for the investment. But maybe we can think how we can maybe better having this link to policymakers, bring this conversation, bringing this evidence to actors that are not already convinced about this, to change a bit the policy, not saying the electoral agenda of our countries. Over.
Thank you. Yes, indeed. Once we make the economic case, then we face the policy cycle and the policy intricacies. And Amber mentioned it about Nepal and Morocco, and we've kept on working, in fact, together in the framework of the UN-wide global accelerator. And even in that context, in which there is high-level agreement and buy-in, it becomes it is not immediate and easy, and there is competition, investments in care policies or in other things. So we are not coming with our offer and buy and face immediate buy-in. It's something that we have to work on and work across government, with workers and employers, and across UN agencies. I'll stop here. I think we've done very well in terms of time. And Paulina, I pass the floor to you.
Thank you so much, Valeria, and thank you to all of the speakers. Now I just wanted to invite each of the panelists to share their final comments or any advice for the many young researchers and feminist economists who are present in this very meeting. If we could keep it to about a minute maximum each, a bit of a lightning round. I see Laura next to me, so, Jerome, go ahead.
Oh yeah, I mean, I don't know how someone starts. Yeah, I mean, so many things, but like keep the conversation going, make lots of noise, make sure that you vote or you encourage feminist politicians, because we're not going to have politicians interested in those issues until they understand the stake that the feminist economics and feminist politics are better politics, and it's a tiring, but it's working, and it's a really groundwork that needs to come from all ages and all experiences, as well as all backgrounds in terms of topics of knowledge, not just economics, and gradually making it like the norm that the care economy is really valuable, as opposed to just thinking on the 20th century old adage of things. So yeah, keep the noise.
maybe my advice would be really keep your work anchored to rights, as we heard today, to lived realities and to policy decision makers. To really stay close to the research questions that matters to people's lives, and the care matters a lot. Also think also on the impact that any policy has on jobs. It's really fundamental, because we don't want to build this on poor quality jobs. We need more, as you know, the demographic projections, and build alliances. This is extremely important. Talk to workers, employers organization. They need you to, of course, women's movements, because the evidence, we don't have to give up on the evidence to really change the agenda. Over.
And to cap up, I would just say, please keep collaborating with us, the practitioners who need feminist economists so much in our work. And I can speak from UN Women's perspective to say it has, with beyond a doubt, strengthened our work at UN Women to collaborate with so many IAFI members. So we are eternally grateful, and there's more we can do on our side to share opportunities. There are plenty, despite the global environment, of opportunities for these collaborations. So really, really grateful to IAFI as a space for this. And please, let's keep up the good work, the good fight together, making good trouble. Thank you.
Thank you to the speakers for those last reflections and all of the valuable information you've shared with us today. And thank you, Valeria, for chairing this very enlightening session. I'm sharing the enthusiasm that I'm seeing in the chat and the reactions all over the screen. We're taking a lot of useful insights on how care policy initiatives have made a mark and how they can be usefully applied to different country contexts as well. Thank you to all of our attendees for joining us today and for this wonderful discussion. Please look out for future IAFI online events. Check out past events on the YouTube channel, which has been posted in the chat, and best wishes to you all.
Thank you very much.
Thank you.
Bye-bye.
See you soon,
Bye.
everyone.
Thank you, everyone.
Thank you all.
Thank you,
Thank you. Bye bye.
Tina. And,